Hello and welcome to Real Health. I'm Michael Porter and thank you for tuning in. The growing number of people having heart attacks and strokes is alarming, and the scary thing is that they don't often even know that they have heart problems. So what are we doing wrong when it comes to looking after our heart health, and how can we go about improving it? In studio today we are joined by medical doctor and integrative practitioner Dr. Arien van der Merwe to tell us how we can go about looking after this vital organ. Welcome Dr. Arien, great to have you with us.
Yes, good to be back again.
Thank you so much. Now tell us, the heart is not just a pump. There are a lot more activities and purposes that it plays in the body. So tell us about that.
Yes, I want to take one step back, and just as you said, it is becoming more and more prevalent and common. And the main reason is that people don't always go for their annual screenings, which often will pick up any potential heart disease. Even going for genetic screening can pick up the predisposition for heart health, heart disease challenges later in life. But the reason why we have more and more of that is that we tend to look at the heart in a very one-dimensional way, which means that we think of it just as this physical pump inside the chest that has to provide blood to the whole body. But the heart is more than that. Of course, that's its very first level of function is to pump more blood, and that brings us immediately to the heart and stress. Because if you have a high stress level inside to the heart and the brain, it feels like a constant trigger for survival. So, and that's the classic fight or flight reaction. Now you are having an attack because of deadlines or workload or just having a type A behavior personality, which is one of the highest risks for heart disease. So your body feels like it's under threat the whole time. So it wants to run away or stay and fight, but
and
it's not.
That feeling of like a tight chest almost. You can feel the sensation that you are maybe breathing is a little bit more difficult. Things are stressful inside.
Yeah, that's
physically.
Already a second step that people become aware, because often they don't realize it. And the best way to get the blood with nutrients and oxygen to the muscles and the skeleton to run away or stay and fight is that the heart would pump. The artery or the pipe must narrow to get the blood through, and that then leads to high blood pressure or hypertension. So even looking at stress already gets us into those deeper levels of the heart is responding to what we're thinking and feeling. But more than that, the heart is actually also a brain. Even more than the brain is, because it informs the brain, not the other way around. So because 65% of heart cells are actually neurons, which are nervous system cells, the heart also makes hormones, which we call peptides or informational substances that inform the whole body. So whatever the heart is thinking and feeling has an effect on the whole body. So if the heart is in stress, that's the message that goes through.
So your whole body then feels stressed.
Experiences it preparing for fight or flight. But if the heart is calming down, then it secretes less of natriuretic factor or ANF, which is the hormone informational substance that the heart makes. Also then with the neural cells, the heart informs the brain and the body, slow down and relax, or vice versa. So it actually generates what we call an electromagnetic field, and quite interestingly, it can be picked up even nowadays with new instrumentation up to 15 meters away from that body. You can pick it up, and if you look at it on a scan, it looks like an apple. You know, if you look at the apple,
the
two sides, and in the center would be, like the core of the apple. So we call it the torus field of the heart, and it generates electromagnetic waves about 5,000 times stronger than what the brain does. That's why the heart is also what we call the seat of the soul, or seat of our emotions, because we connect to others through that heart field.
In terms of dealing with stress and managing stress, is that a case then of saying, how do we get our brain in the right mindset to manage and send a signal back to the heart to say, it's going to be okay, let's calm down a little bit?
Yeah, your stress management is actually focused on the heart and the brain and actually the body. So it's not always the brain sending the signals, it's the heart that then relaxes. Now, if you're in stress, your breathing, as you said before, is fast and shallow, getting ready for fight or flight.
Okay.
So the first and the easiest thing to do is calm down your breathing. Okay. Keep your finger there on your wrist where your radial artery comes through, and that's your pulse or your heart rate. And just breathe in, in and out, and people can actually feel how it slows down. So that is really when you're in a meeting or you're really on a deadline and you feel as though the world's going crazy, just stop, notice your breathing, change it to parasympathetic, the calming side of the nervous system, and make it deep and slow, and then the whole body actually relaxes.
Yes, diet, what we eat, the food that we put into our bodies and the impact that it has on our bodies, and also being aware of a predisposition, so making better choices in your lifestyle to avoid progression or onset of a more serious condition. What is the most important thing to be considering when you are...
You know, I don't want to divert too much from in going into the diet as such, but the ones that are most important, what we call superfoods, are the different berries.
Okay.
Often try and get it when it's in season. Then nuts. Very important, even a combination of the different nuts, and then fish, especially salmon, trout, sardines, and pilchards and mackerel, to provide the omega-3 that we get in the fish oils, because they eat the plants that grow in cold water, and then they can make that specific omega-3. Land-based, excellent then to use coconut oil. You could get the neutral flavor or coconut. Extra virgin olive oil, and then like avocado oil. Those will give you the omega-6 and 9, and then something like flaxseed will give you omega-3, but that comes then from the land plant, which is not so rich in the right form, broken down in EPA and DHA that we actually need for heart and brain health. So of course then also the rainbow of fresh fruit and veggies, 5 to 7 portions a day, and then different colors and different textures, because they've all got pigment based, that's why they have it, to protect themselves, but then we can use it for heart, brain, actually whole body health. But what I say to people, try and eat as healthy as you can, but to really support our heart, especially if you've got a genetic predisposition, you do need to supplement with some basic supplements, mostly powerful antioxidants to support your heart.
And what sort of supplements would those be?
That would be a supplement that's got enough vitamin A, vitamin C, vitamin E, very important, sufficient vitamin Bs, and that's B1, 2, 3, 5, 6 and 9, which is also folate, and then B12, choline, and inositol. They all work together in a process called methylation. So the one goes into the other, and if anywhere in that chain it's broken, then the whole chain becomes sort of weak, and it's very important in the heart. So the basic, but then very important to add coenzyme Q10. And then specific herbal remedies that really support the heart and safe to use is ginkgo biloba, and then hawthorn berry or Crataegus oxyacantha is the botanical name. But really there's so many herbs that support, and the difference with natural medicine and mainstream is simply that natural medicine supports our physiology, whereas mainstream might often suppress some of the symptoms, but they don't really support physiology. They douse the symptoms, but then the side effects pop out. So just to get back to an example, and then of course calcium and magnesium, very important for the whole body. But one thing is there's something called the nutritional cost of prescription drugs. There's actually a book with that name. Now, most important, the heart is intensely, all the cells have got many mitochondria, the whole body, but very concentrated in the heart. They're what we call our power generators. So they make the energy, fuel for the heart to work.
Yes.
Now, many of the prescription drugs for the heart cause a coenzyme Q10
okay.
deficiency and calcium and magnesium.
Right.
Now, if you use that as part of your comprehensive antioxidant, even the medication would work better because it
Okay.
won't cause the deficiency.
Yes, yes.
But to get back again that the heart is more than a pump, we really have to look at the suppressed emotions because they cause blockages, often in the cellular memory of the heart cells. So part of the holistic integrative approach is to help patients. So I would spend time with them and do follow-ups. I do journaling and a little bit of an energy tapping to see where the blocks are, and that is combined then with chakras. So the heart is very much the fourth chakra, but you've got to bring in the third, our power centers, or the sun center, because there's often problems there around your place in the world.
Okay.
And that's from, the power. How powerful do you feel in your world?
And in your situation, whether it be work,
and
family, love.
Exactly,
Yeah.
and there is often where the high blood pressure would manifest.
Okay.
So the two is also a huge separation between the lower chakras and the higher ones. So the heart takes us into the next level of our consciousness,
Okay,
which is very important.
Well, I think you've given us a lot to think about in terms of awareness of our heart and how it's functioning and what it's doing in the body, and also the impact on our emotions and our lifestyles and what it has on the heart. So thank you so much for sharing that with us today.
Greatest pleasure.
Thank you.